Okay, I think we can make a start. Welcome to colleagues online. Thank you everyone for joining us today. It's a joint seminar between the Center for Research on Aging and the Center for Population Change. We are thrilled to welcome, I should say, welcome back Giorgio Di Gessa, who's going to talk to us about looking after grandchildren. Giorgio is one of the people we meet every year or almost every year in meetings. We work on similar data sets. People in both centers will be interested in the analysis that he's doing, work on the same data. So we're all very delighted to welcome you.
Thank you very much for being here. Well, thanks for inviting me, and good afternoon, everyone. As Athena stated, my name is Giorgio. I work at UCL, and recently I've also become one of the co-eyes of the English Longitudinal Study of Aging. So if you have any complaints or questions about that, let me know, and I'll feed those back to the management team. So today's presentation is going to be on the provision of grandparental childcare, and I will indeed provide some of the findings based on the data set that I've just mentioned, the ELSA data set. And this is roughly the outline of today's presentation, pretty standard. So I'm going to give you a little bit of a background as to why grandparents and their provision of care matters. And then I will highlight the contribution of these presentations that are pretty much based on the analysis of the activities and also reasons for providing grandparental childcare, and also on inequalities in these activities by gender and socioeconomic positions, and also how both what grandparents do for and with their children and the reason why they provide this care actually is linked to their health and well-being in particular. And I will give you some description of the data I'm using and the new question that have been introduced recently in ELSA on grandparenting, before giving you some highlights of the results and concluding with some potential discussions for future work in this field, as well as limitations of current studies and data. So why should we care about grandparents? So one of the probably main reasons is that there's been, over the last few decades, but even longer, increasing importance on the role that extended intergenerational kin relationships play. And this is partly driven, the importance of grandparents is partly driven by demographic factors. So increasing life expectancy these days mean that there is there's many years of shared life between grandparents and grandchildren, and this is one of the highest proportion of shared life than ever before. And actually, in today's grandchildren are 75% likely to actually still have a surviving grandparent by their early 30s. And these intergenerational relationships have been linked and increasingly linked to both economic and health outcomes of all the generations and all the members of these networks that are involved in these relations. Just to give you an idea of what grandparents do, they of course provide emotional support to their children and their grandchildren. They also provide economic support for them. But one of the activities that they are very highly engaged with is also the provision of childcare to their grandchildren. So just to give an example, in Europe, and this is data based on the Survey of Health and Aging and Retirement in Europe, about 50% of the grandparents who have a grandchild younger than 16 actually looks after them, and 1 in 7 does so almost on a daily, very high intensive way. So at least 15 hours a week or daily. And similar proportions of engagement of grandparents in provision of childcare are actually observed in other contexts. For instance, in China, 58% of grandparents actually care for their grandchildren. And even in the States, where evidence has been collected from the kind of a grandchildren perspective, about 1 in 4 of preschool children are regularly cared for by their grandparents. So the engagement of grandparents in grandparental childcare is quite high and remains, very high in most countries. And this is, of course, relevant to both the family themselves, who are recipients of this time offered to them by their grandparents. But it's also, relevant for the kind of a greater societies, because oftentimes, grandparents actually step in where formal provision, for instance, of childcare is lacking, or they actually allow, for instance, grandmothers to be in paid employment by providing the care that is not available otherwise. But because of this, grandparental childcare is actually also affected and embedded within the society and different welfare states. So oftentimes also policies around flexible working, extended working lives, as well as provision of formal care and attitudes towards family cares, actually they all shape differently the engagement of grandparents in this activity. And with the increasing focus of on active and healthy aging, this has also become one of the activities that, that is considered, given the prevalence of older grandparents that actually look after their grandchildren. It's also one of the activities that can relate to these frameworks of active and healthy aging. And as I said, there is, this activity also can clash and is related to other agendas, such as the kind of extended working lives. And oftentimes, even grandparents might struggle between, their work commitment that they have, as well as, the help that they want to provide to their family, oftentimes to allow or to facilitate the labor employment of their own children and their own daughters in particular. And on top of this, as you might imagine, grandparenting doesn't just happen differently in different contexts, but it's also one of those activities where we observe inequalities in who does it, and also how socioeconomic factors influence the way that people engage in these different activities. Just to give you kind of a brief example of the complexity of grandparental childcare, this is a graph that shows the proportion of grandparents with a child, with at least one grandchild less than 16, who are engaged in intensive provision of grandparental childcare. So this is about 30 hours per week. And as you can see, across Europe, there's about 13% who provide this very high amount of time to look after their grandchildren. But as you can see, there's also quite dramatic differences across different contexts. So in Italy, Spain, and Greece, up to almost 1 in 4 is looking after their grandchildren so intensively. And these are also the countries where there is less flexibility, where most of the women who work, who actually are in the labor market, are so in full-time employment with very little flexibility in their working arrangements. And therefore, this is where the grandmothers oftentimes step in to allow their working daughters to be in the labor market, but to their own expenses and to their own lower likelihood to be employed themselves. So there's a lot of complexity in these family arrangements when it comes to provision of grandparental childcare. Among the complexities, this is where I will be focusing my attention in this talk. There's also evidence of inequalities in the way that grandparental childcare is provided and in the way grandparents engage with this activity. Oftentimes, it is reported that grandmothers provide more care than grandfathers. But, there are, for instance, some mostly qualitative studies that suggest that actually it really also depends on what activities people are doing. because grandparents are supposedly more engaged with fun activities and playing sports with their grandchildren than grandmothers, for instance, who in qualitative studies seem to be providing more caring for activities. And there's also evidence that suggests that these socioeconomic, there are socioeconomic gradients in the way grandparents engage with their grandchildren. And generally, those who are disadvantaged tend to do it more regularly. They do it mostly out of financial necessity rather than pleasure or for positive positive reasons. And they also seem to be performing more intensive and caring tasks. However, a lot of these studies are generally based on either studies that are based on the parents' perspective, and they don't have a lot of information on the grandparents, or some of these are qualitative studies. And even in the kind of a wide range of quantitative studies, oftentimes there's very little information about what grandparents do, how often they do it, why they do it, and this is where we hope to contribute to the knowledge in this field, because most often these studies, even the ones that are based on SHARE or HRS or CHARS and other aging studies in the world, they often have the question, did you look after your grandkids, yes or no? And if so, either how many hours with very broad brackets of engagements, or just with answers like daily, weekly, less often, without actually knowing what people do when they spend time with their grandchildren, and whether it's a constant provision of care and so forth. And similarly, another area where we hope to contribute by these new data sets and questions that have been recently added to ELSA is to actually understand whether and to what extent different activities and different reasons for caring for grandchildren actually impact or are associated with the health and mental well-being of grandparents. Again, thousands of studies on grandparents' health and how this activity is associated with mental well-being, physical health or health behaviors. But once again, the key information on grandparenting is often very broad and is often quite crude and simplistic, with information mostly based on either co-residence, custodial status, in particular for the studies based in the US, where it's more common than in the European context, and on the frequency of care. And until a few months ago, the only studies where there had been some focus on the more nuanced relationship between activities and health of grandparents were only the two from Davidoff and Hale in recent years. So what our contribution in today's presentation is that we're going to be providing you with and by we, I should say, not just myself, but me and colleagues that I've worked with in recent years for these papers. But I will provide you with gender differences in not only when grandparents look after their grandchildren, but also what they do with them and why they look after them. Moving away from the simple gender differences in the questions yes or no. Then I will also investigate and highlight the socioeconomic differences in, again, the frequency, activities, and reasons for provision of grandparental childcare. And finally, I will also describe whether and to what extent both the activities and the reasons for care are associated differentially with the well-being of grandparents. And to answer all these questions, the data that I've used come from wave 8 and 9 of the English longitudinal study of aging. These are two waves that were collected before the pandemic in 2016, 17, and 18 and 19 respectively. And as most of you might know in this room, ELSA is an ongoing study that started in 2002 with roughly 12,000 respondents. These people have been followed up with biannual interviews, and there's also been refreshment samples over the years to ensure that the representativeness of the sample cross-sectionally will be maintained. And the reason why I use these two data sets is mostly because in wave 8, for the first time, and also the first study among all the HRS sister studies, ELSA introduced the a grandparenting section. So not only as ELSA asked whether grandparents and those who had at least one grandchild had looked after them in the previous year without the presence of their parents, but if they did so, they would also be asked a series of questions about the periodicity of care, the frequency, the number of hours in different periods and for different frequencies, and then also the activities and reasons why they actually look after their grandchildren. So just to give you an idea, for those who actually reported that they did look after their grandchildren in the previous year, then they will be asked things like, when did you look after them? So was it just during the school holidays? Was it during the school term, which in England is about 38 weeks? So it covers quite an extensive period of time. And if so, was it mostly on the weekends and weekdays, or was this throughout the year? Just to also understand, how what was the periodicity of the engagement of grandparents in the care for their grandchildren. And then for each of those potential answers, they would be asked a follow-up question, which would ask them, and was this almost on a daily basis, every day, every second weekend? So obviously, these answers here would depend on what was the initial response. But if someone said that they were doing it mostly on the weekends, then they would be asked, was this every weekend, every other weekend, or less often than once a month? If they said, every day during school days, they would be asked, was it 4 to 5 days, 2 to 3 days a week, 1 day a week, or less often? So that we could really build up a much more granular picture of when grandparents look after them. And in theory, then for each of them, we also have the average number of hours. So there's a lot of detailed information on this. And then they were also asked which activities they did with or for their grandchildren. Once again, respondents could tick as many as they wanted. And for each one of those activities reported, they were also asked how frequently that happened. So if it was frequently, occasionally, or rarely, obviously, these measures might not mean much or might mean different things for different people. But because of the brevity that was requested for this section on the ELSA team, this is as far as we could get for these questions. And then again, they would be asked why they look after them. And once again, grandparents were allowed to answer and tick as many options as they wanted. And as you can see, they go from because it kept me young, I want to be engaged with young people, I want to help them develop, as well as for a financial reason, or help maybe the parents go out to work, go out for dinner without the children, or to actually give either the parents or the grandparents a break, which could be because maybe there are some difficulties at home or a divorce or some other things going in the house. And we also added a couple of questions that would, a couple of answers, that would capture a sense of kind of an obligation rather than, so because maybe it was difficult for them to refuse, or because the family preferred family care as opposed to more formal childcare provision. So in terms of how this information was used for these presentations and the three kind of contributions that I want to describe today. So for when we looked at gender differences, we used simple, well, not simple, we used fully adjusted logistic models. And we did that for both, men, grandmothers and grandfathers separately. But then we also repeated the analysis among couples. So ELSA asked these questions to both partners in a couple. So we could also see how much or to what extent, the couple was concordant or discordant in their answers to the questions about what they do and why they do it. For socioeconomic differences, we use once again either multinomial or logistic regression models, depending on whether we were looking at activities and reasons that were considered one at the time, or whether we were looking at frequency of care. And in terms of the variables used to assess these socioeconomic inequalities, we focus on education and on wealth quintiles, actually quartiles, I should have said. And then finally, for the latest part and how and to what extent these activities and reasons relate to well-being, we focused on depression and quality of life that were captured with the 8-item CESD depression scale and with the 19-item of the Hyde's CASP scale for quality of life. And in this case, we used, although we only have 2 waves of data, we actually used hybrid models to understand both kind of a potential selection into these activities, and also to see whether kind of a changing or activating a new reasons or a new activity would be related to within person changes in depression and quality of life. So some findings. So these are the kind of a different periodicities of care reported by grandfathers and grandmothers. And if I remember correctly, this is actually based on grandmothers and grandfathers who live in the same household. And I think the same applies, to grandmothers and grandfathers generally. So there is not much differences in periodicity between grandfathers and grandmothers. And the only exception, significant without a strong significant difference is between grandmothers and grandfathers and their involvement with school term during the weekday, where grandmothers are slightly more likely to report deaths than grandfathers and or their husbands. But generally speaking, it's quite remarkable to say that there is almost 60% of both grandmothers and grandfathers who report this activity throughout the year. And if we sum them up with the kind of a school term weekdays, that, as I said, is about 38 weeks of the year out of the year, but that's about 3/4 of grandparents that are engaged and involved in this activity almost throughout the year, or very frequently and very but very interestingly, there's also about 1/4 of grandparents who report looking after them when the schools are closed and during the school breaks. When we looked at the activities that grandparents and grandmothers do, the story is completely different. So for pretty much all of the activities, and these are just these are just frequencies that don't account for potential gender, potential age or socioeconomic differences. But generally speaking, grandmothers are way more likely than grandfathers to actually report all of these activities. And this also happens when we have the same couple living in the same household. So grandmothers much more likely to prepare a meal for them, also to be engaged in leisure activities. And this kind of was one of the recurrent themes in the literature, suggesting that grandfathers are more engaged in playing around and take their grandkids to the sports centers and so forth. Whereas we don't find that in the in this population-based data set. And also more likely to take them and collect the grandkids from the nurseries and school. They also report differently that the kids stay overnight. So again, grandmothers are either more likely to remember that the kids stayed overnight or than their husbands and grandfathers in general. And this is really there is quite a clear gender gap in these activities, especially when we look at those that are done more frequently. When we look at reasons for care, we can see that that these have been described from the most often mentioned to the least one. So generally speaking, kind of people report that this activity is for them difficult to refuse, or that they prefer family care is one of the least acknowledged reasons for caring for their grandchildren. And the two ones that are more often, the 2 or 3 ones that are more often mentioned are to help the parents go to work. That is the #1 reasons why they do that. Give parents a break, and also allow parents to go out in the evening. So these are the 3 most often mentioned reasons for looking after grandchildren. And in this case, we find very few differences by gender. And the only ones, are about kind of a development and engagement with the youth. So in this case, grandmothers are more likely to report that as a reason for care compared to grandfathers. And also family care is mentioned more often by grandmothers than grandfathers. And I should say that, that most of these differences that I've shown you descriptively, they also hold once we run logistic regression models and once we actually accounted for socioeconomic characteristics, age, and health of the grandparents. When it comes to frequency of grandparental childcare and socioeconomic factors, and in this case, we really looked at those grandparents who provide care almost on a daily basis, between 4 to 7 days a week. Then consider those who do it a couple of days a week, 1 day a week, like once a month, and then less often than monthly. And these are results from multinomial model, where the reference category is those who provide care on a monthly basis. And in this case, we considered and focus on these 2 socioeconomic variables, where we looked at education and wealth, quartiles in the latter case. And for education, we distinguish between low, medium, and high education, with high education being university or above. What we find is that for wealth, there is a clear gradient, especially when we look at daily provision of care, where those who are in the lowest quartile of wealth are much more likely, than those in the highest quartiles to provide care almost on a daily basis, between 4 and 7 days a week. compared, to those who provide care occasionally a few days a month. And similarly, we find not such a kind of an obvious gradient also for those who care like a couple of days a week, but they're still more likely those who are who are not in the highest quartile of the wealth distribution. They're still more likely to actually provide care regularly, even when we fully adjust for all those variables that I've mentioned at the bottom of this table. Education doesn't seem to play kind of too much of a role, and the only variable, where we see an association between education and frequency of grandparental childcare is with 1 day a week. So this is in line, with literature suggesting that those who are highly educated and are better off tend to have more control on when they actually care for their grandchildren. So the fact that they are the only ones, or that we only find this association with 1 day a week could indeed be discussed with this idea that higher and highly educated grandparents might have more time to decide how often and to control their narrative around what and when they look after their grandchildren. For socioeconomic differences when it comes to reasons of care, and also for what they do with their grandchildren, I'm just going to give you, a bit of a snapshot here, and I think it's mostly because actually these are the most, I think these were the main associations that we found in fully adjusted models. So generally speaking, when we look at grandparents who report that they were cooking for their grandchildren, or they were going to pick them up from school and take them to school, it's those in the lowest wealth quartiles that are more likely to actually report this activity as a frequent activity. And whereas for homework, we find that it's those who are highly educated that are more likely to actually report this activity who are more likely to report this activity. And for helps to parents, we also find some interesting socioeconomic differences, where, for instance, those who are in the least wealth quartiles are less likely to actually report this reason for looking after grandchildren, whereas those who are highly educated are more likely to do so once we adjust for all the other characteristics. Finally, a few snapshots results on the associations between the activities and health, and also in the next slide between reasons for care and health. And by health, I really mean quality of life and depression. And these are results from hybrid models, where we also tried to account for the frequency not only of the respondents, but also how often people actually spend with their grandchildren. So we try to define caring for activities and distinguish between the frequent ones that are done at least once a week. So we know that the respondents spends at least 1 day a week with their grandchildren, and they also report that they do that activity frequently. And then occasional would be anyone who actually doesn't spend at least 1 day a week with their grandchildren, regardless of how they report that activity. And what you see here are these, for each of the activity and each of the outcome, you see 2 different lines. So the one between really compares groups of those who do versus those who don't do that activity at different frequencies. And this is really what we find is kind of what has been found consistently in the literature. So generally speaking, those who are caring for grandchildren and doing these various activities have got higher quality of life than those who either don't care at all or don't look after them at all, or who don't look after them at all. And they are also more likely to be depressed. I know that this doesn't, because these are, so this should be, the question was, I don't remember now why it's minus, but they are less likely to be depressed because we use this as a categorical variable. So these are about they're 3% less likely to be depressed. That's why now. But I think I should add here depressed rather than depression. So that's why I was getting confused. So these are binary depression, yes or no, where minus means that you are less likely to be depressed. So this is quite this has been found in many studies that have, of course, not looked at these specific activities and reasons, but oftentimes those who provide care seem to be in better health than those who don't provide care. And this is what we find when we compare these two groups as a group of carers and group of non-carers. But when we look at the within differences, then we find a very different story. And that is that either we don't find any associations at all between these activities and mental health and well-being, or if we do find it, are in some cases, like they suggest, for instance, in this case, that if someone starts to look after grandchildren and caring for activities for them, including cooking for them and looking after them when they're sick, then their quality of life actually decreases by almost 1 point. So very different pictures when we compare the group of parents and grandparents caring versus those who don't, as to what we observe when we look at within-person changes over time. And similarly, we also find something of very similar when we look at reasons for care and mental health. So once again, the between model seems to suggest that those who provide care and mention these reasons are better off than those who don't provide care. But then when we look at kind of a longitudinal within changes, we find either nothing or, for instance, a higher depression among those who start caring for grandchildren and mention that they do so to help their parents go to work or go out at night. So kind of a quite different stories depending on whether we look at the groups or whether we look at within changes over time. So to conclude, in general, we find very few differences in periodicity of provision of grandparental childcare. However, grandmothers are more likely to actually undertake help and caring activities. And I think that, that this probably also says a lot about some of the very small differences found in other studies, where it's likely, that actually grandparents pick the same answers as their wives without actually then doing the job. So they are there because the kid is there, but actually is being looked after by their wife. So if we just look at frequency of care, we might think that there is less of a gender gap than there is when we actually look at what people do and how often they engage and what activities they do with their grandchildren. So then it looks like that once again, gender norms and these differences are quite strong, even when we look at the provision of grandparental childcare among English grandparents. For socioeconomic differences, we also found in ELSA and among older English grandparents that there are, that these activities also socioeconomically patterned, with those in the lowest wealth more likely to care intensively, so like a couple of days, if not every day, and also to do activities that are more hands-on, such as cooking, such as picking up the kids from school or taking them to schools or looking after them when they're sick. And they're also more likely to mention that for them it is difficult to refuse this the engagement in this activity. And for education, we found, as I mentioned earlier, that grandparents in higher level of educations are more likely to care for grandchildren only one day a week. And also in terms of activities, more likely to help them with their homework and provide emotional help, as well as help parents to go out. And in terms of the relationships between grandparental childcare activities and reasons, and also their well-being, what we found in our study is that most of the variations really is between grandparents rather than to changes that happen within grandparents over time. Of course, we only have 2 ways, and hopefully with the following ways we can maybe assess longer term and have more changes over the years. But I think that this really goes into the increasing number of studies that kind of warn on the selection effects that happen when we're looking at the associations between grandparental childcare and health. And if anything, we find that some activities are associated with poorer well-being and higher depression over time. And the same also happens with reasons, where we find very few differences within individuals, much more between individuals. But if we do find some suggestions, is that those who start caring for a sense of duty and obligation rather than for pleasure and their own advantages are associated with poorer mental health and well-being. And this last one, has just been published, I think, a couple of weeks ago now, or like a month ago, and it was work done with Karen Glaser. There is also one of the co-authors of many of the other papers on this issue. And before concluding, I just want to kind of also remind myself of where we are, where we could go, and also what the issues remain when we look at grandparental childcare. So first of all, I think that what has been done in ELSA is great, because there's been more detailed information about grandparent and grandchildren interactions. And these are very important, especially to further highlight gender, socioeconomic differences, but also to understand, what and how nuanced these relationships can be, and how these nuances actually affect differently well-being of grandparents. But unfortunately, there is still little information, and ELSA doesn't help in this, about actually the extended characteristics of the family. So it's quite likely, for instance, that a lot of the inequalities and wealth inequalities that we observe in grandparents are also due to the fact that their own children are probably not much better off than the grandparents themselves. So, it could just be a reflection of the inequalities within the extended families. But unfortunately, ELSA doesn't collect any information about whether their children are employed, they're divorced, where they live. So we are limited, but this is certainly an area that should be further exploited. And finally, I also want to say that, that at the moment, there are several selection issues, and hopefully by wave 12, there's going to be a few more information available on this. But at the moment, information is only asked to one set of grandparents. So we don't know actually if they don't look after their grandchildren because the other set is looking after them. or it's because, you know, their own like health, or because they live too far away, or because they don't have a good relationship with the parents of their children. So there is still a lot of unknown about those who don't look after grandchildren. And again, you know, more information on this could shed even a more nuanced picture of what happens within the families. And obviously, you know, there's a lot of new families that are happening, exist right now, including, you know, LGBT families, families that have gone through divorces, remarriages. And I think in the States, the evidence suggests that probably 1 in 8 grandchildren these days has got up to 8 grandparents. So a lot of competitions among them as well to decide who looks after them. So a lot of reasons to continue to investigate this area of research. So as I said, you know, these are some of the references and the main kind of 3 papers that I've mentioned that I've presented today. And I thank you once again for your attention, for inviting me here, and I'm happy to answer any questions or any comments that you have. Thanks so much.